Hi, I'm Dr. Annie Savage. I'm a naturopathic doctor working out of Vancouver, British Columbia. Today in our video, we are going to talk about PMS. By the end of the video, you will have an understanding of what PMS is and how you can fix it so you aren't dealing with it every single month. Please like this video and subscribe to our channel for more. Click the bell and you'll receive those notifications when we have a new video out every single week. PMS stands for premenstrual syndrome. In the medical community, when we use the word syndrome, we're referring to a set of symptoms that are correlated and are affecting a disease condition. In this case, that disease condition is actually your period, so it's not really a disease condition at all. But the symptoms that you are experiencing about a week to 10 days before your period would be considered PMS symptoms. There have been over 150 symptoms documented as PMS symptoms, and they actually affect every system and organ in your body. So it is a lot to deal with if it's very severe for you. We also know that 1/3 to half of all women of childbearing age, or women who have a period, do experience PMS or these types of symptoms. Common symptoms of PMS are depression, anxiety, insomnia, constipation or diarrhea, weight gain, water retention, acne outbreaks, herpes outbreaks, headaches, migraines, vision changes, insomnia, fatigue. The list really goes on. Irritability, mood swings, mood changes, food cravings for salty food or sugary food. Some people will experience extreme swelling. They retain so much water that their hands and feet will swell. Breast tenderness, breast pain, vaginal pain, pelvic floor pain, cramps, backaches. Let me know in the comments below if you're experiencing some of the PMS symptoms that I listed. In what severity do you experience them? Is PMS really ruining your life for a couple days? Are you scheduling around your period? Do you have to take time off work? Any of those things are not okay. It's very common, but it's not normal and it's not okay. We really want to help balance those hormones to keep you happy and healthy. More often than not, women are told that their PMS symptoms are normal and to just take Tylenol, Advil, or Midol, some type of pain medication to help with them or to get through the day. Other times women are given birth control pills, which is a synthetic hormone-based product. So you're given hormones, you're taking hormones in your system, your body will stop creating your own hormones. So this will normalize your hormones because we're actually giving the body those fake ones or synthetic hormones in drug form. The problem with that is when you go off the pill, say you want to have a child at some point, you start to go off the pill, your hormones are still unbalanced from 10 years ago whenever you went on the pill. So you're really covering up those symptoms, and then when it comes time for fertility, you might have a more difficult time rebalancing those hormones because it's now been 10, 15 years that you have not dealt with it. A better solution to handle your PMS is to balance your hormones. So let's talk about how we can balance our hormones naturally. First and foremost, we want to reduce inflammation. To reduce our inflammation, we need to look at how we're treating ourselves. Look at what we're putting in our body, how we're moving our body, how much we're sleeping. So for foods, the brassica family of vegetables supports our liver so much. The brassica family of vegetables are the stinky ones, those cruciferous vegetables. Broccoli, cauliflower, Brussels sprouts, bok choy, cabbage, all of those vegetables have properties in them that help the liver metabolize our excess hormones. Your liver is probably the coolest organ you have inside your body. Everyone knows that it processes alcohol and drugs, but it is also making and breaking down our hormones. So we need to give it a little extra love, take out the alcohol, and add in these brassica vegetables to help support that detoxification. We can drastically reduce your inflammation by changing what you put inside your body. So dairy and sugar are some of the top contenders causing a lot of inflammation. Gluten, corn, and soy are the other three that add a lot of inflammation to our system. So if we remove or reduce these food groups, we see a lot of symptoms resolve pretty quickly, which is really nice. We also want to look at how much water you're drinking. You should be drinking half of your body weight in ounces of water per day. So if you weigh 100 ounces, that would be 50 ounces of water or 1.5 liters. Typically, we say 2 liters and up would be sufficient for most women. We can also eat certain foods at certain times of the month which will help our estrogen and our progesterone balance. So one way that we do this is in the first half of the month, the follicular phase that I mentioned earlier, where estrogen is meant to be highest. You can add in 1 tablespoon of freshly ground flax seeds to your diet, as well as 1 tablespoon of pumpkin seeds. These seeds will help increase the estrogen profile with the fats within them. In the second half of the month, when our progesterone is high in the luteal phase, we want to have 1 tablespoon of sunflower seeds and 1 tablespoon of sesame seeds. And this helps keep our progesterone profile high so that we can balance estrogen and progesterone together to avoid all of those symptoms. I'll have a link below where you can download a guide called Seed Cycling that will help you eat for your period. As always, if you have any questions or comments, please leave them below and we will be sure to respond to you. Let us know if you have any burning topics that you want to learn about, and we'll also make a video regarding that. Thank you so much for watching all the way to the end. Please subscribe and don't forget to hit that bell so that you get notified every time we have a new video.